Hello and good afternoon. My name is Erin Dean. I am the statewide coordinator for Healthy Families Oregon, and I just want to welcome you all to this webinar, specifically as an update and kind of where are we now around the Oregon Universally Offered Home Visiting Initiative. We would just thank you for taking your time to be with us today as we provide some updates for you. Gosh, I guess I skipped to the first slide already. Our purpose today is to provide all of our stakeholders with the latest information on what's happening around universal home visiting in Oregon. Here are some bullet points of what we'll go through in the next 60 minutes together. I'll do some introductions of who's going to be on our call today, some brief housekeeping as well. I'm going to share a little bit of background on what is universal home visiting and why is that something we would want here in Oregon. Where are we now? I'll do a little brief kind of back history on kind of where we've been over the last year and then where are we now. And then we have the great pleasure of hearing from two of our local early adopter communities and hearing about the work that they've done so far, what they've learned, and kind of where they are going, what their next steps are going forward. And then we'll have a few minutes for questions at the end. So again, my name is Erin Dean, statewide coordinator with Healthy Families Oregon. I work in the Early Learning Division at the Department of Education. Later on this call, we get to hear from Sarah Poe from the Malheur County Health Department. We're going to hear about the work that's happening in Malheur and Baker counties. And then we will also get to hear from Rebecca Collette with the Washington County Health and Human Services Department on the universal home visiting work that is happening in Washington County. So just two real quick housekeeping items. If you have questions, type them into the chat box and then we will answer all of those questions at the end of our presentation. So just some brief background. What is universally offered home visiting? So this is an initiative here in Oregon to strengthen families by offering voluntary home visits by a nurse very quickly after the birth of every child. If you work in early childhood in Oregon, you know that we have a beautiful array of home visiting and early childhood services for families, but we often are not able to reach all families. And so the intent of the universally offered home visit is that every family would be receiving 1 to 3 home visits after the birth of their child. And why? Why is this something we want to do in Oregon? Because having a baby isn't just hard for families that have high risk. Having a baby is hard for all families, whether you're just needing some support and connection to some local resources or whether you're needing more intensive long-term home visiting support. Some home visit right after the birth can help answer some of those questions, make some of those connections in your community for families, and just really provides the support that all families need. So many of us are so excited about this work happening I would also just add the excitement around this work happening here in Oregon. Oregon's the only state that has legislation that supports universal home visiting across the state for all families, and that is really exciting. So these are some goals of our universally offered home visiting work. Create and strengthen community-level systems of care for families and newborns. Offer support to all new parents in Oregon, regardless of risk, insurance, income, increase access to community services and supports. Obviously, if we are able to connect with every single family, we would be able to provide those access points to families and to help them figure out what are those points of resources that they need the most and help connect them to those. Promote collaboration and coordination across Oregon's early childhood and home visiting systems. I feel like that has happened a ton already and excited to see how that improves and continues. And then improve health outcomes for all families across the life course. So the model that Oregon will be implementing for university offered home visits is Family Connects model out of Durham, North Carolina. The four main pieces for this model is that, one, it's for everyone, regardless, as I said before, of income or background. The first visit usually takes place about 3 weeks after the baby's birth, and families can have 2 or 3 visits if needed as well. There's no cost to recipients, and the visits are made by highly trained registered nurses. If you'd like to learn a little bit more, again, this is just kind of a brief overview. If you have more questions, you want to learn more about the Family Connects model, there's a recording from the last webinar available at this link. I will talk kind of slow as I transition to the next slide. So you can write that down. There's also an email we'll provide you at the end of this webinar, and if you miss this link, you can email that email address and we can provide that link to you. So some updates in Oregon. Where are we now? I'm gonna back up a hair and talk about just briefly, last spring there was a request for, I think they were, might get this wrong, I think they were called requests for proposals of communities that wanted to kind of be in the forefront and be our early adopters. So we were looking for not just communities that were poised and ready to go and had everything in place, like had all their community partners ready and excited and let's get this going. We also wanted some communities that weren't quite sure how they would do this or who their community partners that were interested might be. And we wanted some communities right in the middle. So really taking this as an opportunity to learn as much as we could, learn about what works well in communities that are ready, what works well in communities that aren't ready, and everywhere in between, and what doesn't work well. So these were the 8 communities that applied and were selected to be in our first phase of early adopter communities. So we have Clatsop County Public Health, the Early Learning Hub in Lynn, Benton, and Lincoln counties, the Early Learning Hub of Central Oregon and High Desert ESD, the Eastern Oregon Early Learning Hub for Baker and Malheur counties, Four Rivers Early Learning and Parenting Hub, and that is that hub serves Hood River, Wasco, Sherman, Dillon, and Wheeler counties. Lane County Public Health, Marion and Polk Early Learning Hub, and then Washington County Public Health Division. So currently, these 8 communities are working really closely with Family Connects International. Family Connects is providing support to all of these communities as they kind of go into the planning stage, or they're already in it now, as they map out with their community partners how Family Connects, how this model will work for their community. We recognize it will look different in each community. And so Family Connects has been working with each of these communities through regular phone calls and site visits, coming out here to Oregon very often for site visits, and really helping communities pinpoint their strengths and the needs in their community to determine how this will be implemented specifically for each of them. They're also in the process of identifying community partners that they will be collaborating with, and just recognizing that every community is different, and so their timelines are also going to be a bit different. At the state level, there is rulemaking happening. There is a rules committee. Senate Bill 526 directs the Oregon Health Authority to design, implement, and maintain the voluntary statewide program that will provide the home visits to families with newborns. So the rulemaking is part of that process. It outlines regulations, procedures, and standards of implementing Senate Bill 526. The OARs are currently being drafted and refined by input from the Rules Advisory Committee. It is expected that the draft rules will be posted in mid to late December with a public hearing and public comment period in January. So if you're wondering if you might have an opportunity to provide some public comment, you will. And then the anticipated finalization of those rules would be in April with an effective start date of January 2021. The Oregon Health Authority is also currently in the process of hiring for 4 new staff positions that would be directly focused on this work. Those positions are public health nurse consultants, health plan integration specialist, research analyst, and an administrative support staff. Up until now, there hasn't been any new capacity in staff to go towards this work. The work has been done by staff who already had full-time jobs, and we're working this in to make sure it happens. So we're excited to have some staff positions and capacity directly dedicated to this work. So now we have the pleasure of hearing from our partners in Eastern Oregon. And I think there's one more slide here. Yep, so this is Sarah Poe from Malheur County Health Department, and she's going to tell us a bit about the work that's happening there.
Hi there, can you hear me okay?
Hey Sarah, yep, we can hear you.
Wonderful. Well, thank you so much for this opportunity. We applied as the Eastern Oregon Early Learning Hub. And that director is my mother, Kelly Poe. And so I have to give that disclaimer because I think I used her invitation to check into this meeting. So I'm Sarah, she's Kelly, but we're both really excited about this, as is Nancy Staton, the director of Baker County Health Department, because as we really talk about how we're going to serve our very rural and frontier counties, it made more and more sense that we had to apply for this opportunity because it meets so many of the needs that we have. The geographic area was chosen because we have health departments and birthing hospitals, that's St. Alphonsus in Ontario and St. Alphonsus in Baker, that have demonstrated readiness. And it really is the early learning hub that can pull together the resources and be able to make this have a much larger span, because Malheur has the capacity more than Baker and Wallowa at this point. So we applied as Malheur and Baker would do this, but the hub includes Wallowa, that does not have a public health department at the moment. And so we are hoping to be able to expand in time through the hub across all 3 counties. We are in the planning phase right now, and we are planning to be able to have these universally offered home visits starting in 2020. We have a hope to have a soft start in April, so actually sooner than later, and then to begin in Malheur County in July of 2020. The 2 birthing hospitals are the only obstetric centers in Malheur and Baker counties. The hub is working directly with our public health department, which is me, and also Rebecca Stryker is our home visiting coordinator, and the Baker Public Health, Nancy Staton. We also couldn't do this work without our maternal child health, reproductive health, and WIC programs, as well as the Eastern Oregon Coordinated Care Organization. Right now, we're still a little unsure about how our CCO is going to be part of this moving forward. But Tammy Pierce, who works for Gobi, she's the early childhood coordinator, was really helpful to me in just writing our letter of intent and getting us the data. And they've been really supportive so far with everything we've planned. Ashley Alvord, our coordinator out of Duke, has been here. She's done a few trainings and in person with us, and then also we meet almost weekly by phone And we meet regularly with our core team, which is Kelly Poe and Rebecca Stryker and I. And she's also done trainings for our Cradle to Career partnership, a monthly meeting of community partners that are focused on services for prenatal to age 5. Recently, the Malheur Health Department has started coordinating with Valley Family Health Clinic. They include Treasure Valley Obstetrics and Treasure Valley Pediatric Clinics. And so they are also our FQHC in the area. And we're hoping to be able to start just with their clinic, which actually serves quite a large percentage of the births, and the pediatric patients in our area, but to be able to have a soft start with them in April, to be able to work out our process of referral and education and just how that's going to work. Ashley is going to be back in Ontario next week for 2 days, and we have a meeting set up. Well, we have 2 full days of meetings, but we're going to go back to our Cradle to Career partnership and meet with our Early Learning Hub. But we also have a very important half-day meeting with Valley Family, where they are bringing their head of pediatrics, an obstetrician, their CEO, their head of behavioral health. Several important players are going to come to the table, and we're just going to work through how this soft start will happen. And I'm actually hopeful that we're going to be able to get some referrals and build some momentum for this program just out of the conversations that are going to start next week. The Cradle to Career partnership is also going to start working on the Family Connect agency finder. Both Baker County and Malheur County do not have a formal social services referral finder, or really any kind of formal system outside of 211, and 211 can be kind of tricky in these areas. It's definitely getting better, but the Family Connect agency finder is not replacing 211, but it's going to be something that's really helpful and useful for the families that we're serving. Some opportunities and challenges. We have one hospital system that's serving both counties, and they are a strong partner, and so that's been really helpful. That I realize that makes it a little easier for us that we essentially have one partner with 2 locations. Does make it easier perhaps than locations that would be having to coordinate with multiple hospitals. However, we are on the border. We're 3 miles from Idaho, and a lot of our births for families who live in Malheur County are actually happening in the Caldwell to Boise area. We're hoping that that's really going to be more of an opportunity than a barrier, and we just need to be better connected with the pediatric clinics and making sure that we're still communicating well with the hospitals in Idaho. Our biggest challenge is the multiple moving systems in Oregon around early learning systems. As much as there are challenging deadlines, we know that there's just a huge opportunity here for kids and families. I also wanted to take just a moment to talk about some of the unique challenges to Malheur and Baker. For one, number one is our childhood poverty rate. For Malheur County, 31% of our kids live in poverty, and that's 26% in Baker. Baker is 30th in the state for infant mortality rate, and Malheur is at ranking highest for the teen pregnancy rate. We were 46 per thousand this last year. Our childhood abuse and neglect rates are 34th and 33rd in the state. And Malheur has a 34% Hispanic population, and we have a growing refugee population. We are very diverse. We also have just a really young population. 6.2% of our populations between Malheur and Baker are under 5 years old, and that's both of us have those percentages much higher than the state average. And so those concerns definitely are informing the way that we are moving forward. So moving forward, the health department and Valley Family are really going to be coordinating those logistics, working more with Ashley, who has been just awesome. She is going to continue to meet with our core team and the community partners, doing that agency finder and referral system. We have training coming up in North Carolina at Duke. We're hoping for that soft start in April 2020 with Valley Family Healthcare. And soon to follow, we'll be moving into the St. Alphonsus OB and PEDS clinics in Ontario, and then we will expand to Baker and hopefully be building a model that could be replicated in Wallowa after that. That is all I have for report for Eastern Oregon.
Sarah, thank you so much. Great to hear what's happening in your guys' community, and thank you for your time today to share that with us.
Thank you.
All right, so now we are going to hear from our partners in Washington County. Rebecca Collette is with us to tell us what's happening there.
Thanks, Erin. So just quickly, I'm going to provide a brief overview of why Washington County decided to apply to be an early adopter, as well as some of the successes and challenges that we've faced in Washington County. So just really quickly, Washington County is a geographically and culturally diverse community. We have over 600,000 residents and 6,500 live births a year. Even with this large birth population, it was pretty easy for us to decide to be an early adopter. The timing was key. For the last several years, our home visiting network, as well as our perinatal resource and referral service, Early Connections, have been trying to develop a plan to offer at-birth nurse home visits, really focusing on families that were either referred to or interested in receiving home visiting services, such as Healthy Families and Nurse Family Partnership. But not all the families met the eligibility criteria to receive services. And also over the past several years, we have been engaged in developing a coordinated referral system, and recently reached an agreement to merge Early Connections, our perinatal resource and referral service, with Help Me Grow in a pilot project to collaboratively provide a welcoming entryway and service navigation supports for families prenatally through early childhood. With all these developing systems and programs, it made sense for us to also add Family Connects to the mix and align and leverage the current efforts and desire and motivations in our community. Washington County's early adopter application and initial planning efforts have been a collaboration between our public health division and our early learning hub. The Family Connects planning and community alignment process has since expanded since our application and is now embedded in our prenatal, child, and family support network. Next. So the slide that you see here is Washington County's prenatal, child, and family support network structure. And it includes an executive committee that provides oversight and stewardship of the overall network, and includes strategic planning, policy, and systems development. We also have a community advisory board that provides programmatic oversight and quality assurance for programs serving families and children prenatally through early childhood. We also have a learning collaborative, which is a much larger and broader community network that collectively provides opportunities for sharing, learning, and acting. They provide brief, informative presentations, review qualitative and quantitative data trends, engage in systems thinking, and when necessary, engage in collaborative problem solving. And then finally, we have a referral network This network provides service triage and support for families with complex needs and works to really address some of the local challenges and barriers families may have to accessing services. Next. So our core team that has really been behind the community alignment process is our executive committee. They have been leading our community alignment efforts, and they consist of representation from multiple divisions in Washington County's Department of Health and Human Services, which includes public health's maternal, child, and reproductive health and WIC programs, children, youth, and families early learning and parenting together hubs, and human services behavioral health section. We hope to really expand membership to include stakeholders such as medical and healthcare providers, CCOs, and community-based organizations. All of these entities or organizations are really involved in all different components of our network, but the executive committee is rather new, and so we have yet to expand membership. Next. So our Community Advisory Board has been in existence for a couple years, and they provide oversight and quality improvement for prenatal to 3 programs, including Healthy Families, Nurse Family Partnership, Help Me Grow, and now Family Connects. The Community Advisory Board has, oops, I already said that, sorry. We have recently developed a charter to address some of the changes that are occurring and to really make sure we have diverse and consistent membership. One of the challenges that we have faced historically in Washington County is really having consistent membership on our community advisory board. So with the addition of Family Connects, we had decided to go ahead and develop a formal charter. So some of our partners and stakeholders that are involved in different levels of the network include Community Action, LifeWorks Northwest, Youth Contact, Adelante Mujeres, Northwest Regional ESD, OCDC, schools, libraries, our coordinated care organizations. HealthShare has been very involved with our new care organizations that are now in Washington County. They are also at the table and starting to help us with this planning phase. We have 3 hospital systems in Washington County. So each one of those systems, each one of those hospitals are at different places in our network. We have Providence, Kaiser, and Tuolity. We also have medical and behavioral health providers and our home visiting programs engaged in our planning process. Some of the accomplishments, I have to often remind myself that we've only been doing this for a few months, are that we've had several community countywide kickoffs. The first one we had was with our early learning community and our learning collaborative. We then also had a kickoff with our medical and healthcare providers. We've had multiple listening sessions to really help inform and hear from our community, one on their readiness and any challenges that they might see as we move forward. We also have had specific strategic planning sessions with our maternal and pediatric medical providers. And we have, as I mentioned earlier, expanded our community advisory board and charter to include Family Connects, as well as medical and healthcare providers. So even with all of these accomplishments, we have had a few challenges. One of those specifically being that we somewhat underestimated the capacity that was needed for the community alignment process in a county our size. We, as the state, do not have designated staff to solely commit to Family Connects yet. The responsibilities have really fallen on county and community partner champions to engage the community in our strategic planning process. With this limited capacity, it sometimes is very challenging to maintain the momentum and the excitement within our community. The community alignment process has also brought to light the need to address and break down additional silos, as well as the need to carefully construct systems of communication in a manner that avoids creating new silos. Overall, our community is really excited about Family Connects, but they have brought up a few concerns that they have voiced in the planning sessions. These concerns include whether we will be able to develop a culturally diverse workforce and if the services will be culturally responsive. They also have brought up concerns related to will there be enough services for families as we get to a point where all of our families are receiving a Family Connects visit? And a lot of that concern really lies with our behavioral health supports. So where are we now? We are still planning. We anticipate that we will begin to offer services. We'll have a very soft start in July of 2020. Currently, we are developing an extensive map of all the perinatal services in our community. We're working with our providers to develop clear referral pathways and communication strategies. We're developing a logic model and developing our operations model or models. These models may end up looking very different according to each hospital system and their infrastructure and capacity. But we are also looking to include strategies to engage families that may not have their baby in a hospital setting. So in Washington County, we have multiple opportunities to become involved. And up on your screen, you'll see our most recent, the one that's coming up next week, actually, November 14th from 12:30 to 2:30 in Hillsborough. We will be talking, or Ashley actually will be joining us, we think. If not, myself and Jessica will be sharing information from our community alignment process and the information that we've been gathering for the last couple of months by the multitude of our stakeholders in Washington County. So if you're interested at all, please email myself or Jessica and we will go ahead and send you an invite, or if there's other areas that you want to get involved, we're happy to have you.
All right. Rebecca, thank you so much for sharing how this work is going in Washington County and for your time today to be here with us. I am going to go to Derek and see if there are any questions.
All right, thank you, Erin. So we've got a couple of questions. If anybody else would like to submit questions, you can do that by typing in the chat box. So our first question is, there was discussion at the first RAC meeting for developing home visiting OARs that suggested the law that was passed may actually allow a family to receive up to 4 visits. Has this been clarified and resolved?
And I'm going to try answering this. This is Anna Stiefvater. I'm a public health nurse. I work in maternal and child health here at the state public health division. And I'm helping to work on the rules and convene the RAC, which is the Rules Advisory Committee. So we're working on clarifying language specifically for the rules around the number of visits based on the discussion at the last RAC. So we'll come back. We have the next meeting of the RAC is next Thursday, and we'll come back to that group with some proposed language to clarify that. I will offer that, a lot of this is, as we discussed, is based on the Family Connects model. And what we know about their model is that most people get 1 visit. So the majority of families under this model will get 1 visit. And then based on some assessments and needs of the family, they might get additional, but the majority will get 1. And the idea is that you then refer them on to other services that they might need.
Thank you, Anna. Our next couple questions might be good ones for our early adopter communities. So our next question is, has anyone started working on how the referral process will work? Sarah or Kelly or Rebecca, would one of you be interested in answering that question?
Sure. This is Rebecca from Washington County. We have definitely started working on what the process might look like. However, there's still a lot of details to be figured out, especially as we identify which of the 3 hospitals will be our first hospital to move forward with Family Connects. And it will be different also based on the operational models on if we are having our nurses in public health or if nurses will be located in our hospital systems.
Thank you. Sarah, did you have anything that you'd like to add to that?
Yeah, this is Sarah and Mel here. You know, I assume that we'll have some bumps down the road when this actually goes into practice, but what we've discussed, at least just with Valley Family, the F2HC that we're going to start with that does both OB and PEDS, is that this would become something that is automatic and integrated into their forms so that we're making sure that this is being addressed throughout the pregnancy and that we are touching base with a home visiting nurse before birth, and that it is also integrated into the pediatric visits afterwards so that they make sure that, okay, have you had your home visit yet, and following up on that to make sure that we're trying to capture them both during OB and even potentially with PEDS. But it's pretty essential that this is going to be part of the process from our referring partners, that that we get that data.
So this is Kate here at the state, and I just want to just echo that the answer to this question is really community-based. And so I think you've heard what 2 different communities are, how they're approaching this, and that is precisely why there's a year preparation in this community alignment process before services actually start, is to identify how best to set up those referral pathways and processes and who's going to oversee what and take care of what pieces of it. So I think we've got a couple of really good illustrations of that.
Thank you. The next question is, what platforms are being looked at to host the Community Finder?
And Rebecca and Sarah, I don't know if you've started having those conversations yet or not, and if you'd like to speak to those.
So the Family Connects Community Finder is based on Salesforce platform. In Washington County, actually in Washington, Clackamas, and Multnomah County, we've recently adopted Help Me Grow, which also has a service directory component to it, and it is focused on prenatal to 3. So we're still trying to kind of figure out if we're using Family Connects Agency Finder or Help Me Grow, or possibly even both. Family Connects has really explained that the Agency Finder in Family Connects is really, really specific and in-depth for the services that the Family Connects nurses may be seeking and referring families directly to.
Yes, this is Sarah and Mel here, and that's what we have learned working with Ashley also, is that it's pretty important that we are using the Family Connects Agency Finder, at least for our Family Connects program. We're at a bit of an advantage in our disadvantage of not having an agency.
Right.
So there isn't that decision between 2, but I understood that there was
still a question at the state level about whether they were going to be able to use the Family Connect technology, or if they were going to try and integrate it into Theo or something else.
Thank you. All right, our next question is, how will you work with hospitals around TCM, which is Targeted Case Management, billing? Will you subcontract through public health?
So this is Anna again, and I'll try to address that. I'm not totally sure if I understand the question. So Targeted Case Management is a Medicaid reimbursement opportunity that we currently use in public health nurse home visiting programs. And that is the plan for providing some reimbursement for Medicaid-covered newborns for the universally offered home visiting. The hospitals, you know, the model usually in most places where the model operates, the hospitals is where you connect with the families initially, but they aren't doing, we wouldn't expect the hospitals to be doing billing for targeted case management. So that would be, the home visiting service provider would be doing targeted case management billing. And there are some parameters around how that program works, which requires some matching of government funds. So public health needs to be involved, but I'll kind of leave it at that. It's sort of a lot of technical information, but we're sort of thinking through those pieces.
Thank you. We don't have any other questions. That was our final question.
While you're thinking to see if, oh, go ahead, Erin.
Oh, no, go ahead. I was going to wrap it up, but go ahead.
Well, I was just going to give, talk just a moment just to give people time if there are any other questions that you want to enter in. This is Kate again. But we really appreciate everyone's efforts. I think as both Sarah and Rebecca have said, you know, it's a journey and there will be bumps along the road, but we really need everyone collectively to make this effort really come into fruition to benefit the families of Oregon. So we really appreciate everyone's good thinking and thoughts and contributions and hard work on this. It's we're starting to, you know, launch these trains and get things rolling, and it's very, very exciting. So we really appreciate it all. And with that, we don't have any more questions. So I'll turn it back over to you, Erin.
Thank you, Kate. And thanks for all of your great leadership through all of this. Your excitement and enthusiasm for this work is super contagious, and I feel it just by listening to you talk about it. So thank you. And just another thank you to Sarah and Rebecca for your time today and sharing your guys' journey so far through this work, and to everyone else for joining on and your interest in this work. Thanks for your time, and yeah, I guess have a great rest of your day. It's almost done, and we're getting close to the weekend. So, have a great day.
Thanks,
Thank you. Bye-bye.
Bye.